Welcome to another session in the role of preservatives in disease. As you're probably aware by now, I'm Socrates Angelides, and I've been conducting research into the area of nutrition and its effect on health and disease over the last 15 to 20 years. What my research has shown is that preservatives are very detrimental. They're responsible for multiple scores of disorders and symptoms, and they're like any other drug. When you take a drug such as an antibiotic, it does not only act on the bacteria, but it has effect on the rest of our bodies. And so for some people it may upset their stomach and the bowel and lead to diarrhea. For others it may cause a rash. For a third person it may cause some shortness of breath. Preservatives seem to have that similar property. That is, they act differently in different individuals and affect different parts of our systems. Now, today I'd like to discuss the role of preservatives in mental health. Mental health is a very topical issue at present, and just this week the Australian government introduced several measures in its budget to help control and combat the rising prevalence of mental health. It is a condition that is very expensive to treat, very difficult to treat, and creates a lot of anxiety and pain and misfortune to not only the sufferers of these conditions, but to their carers and other people who are close to these individuals. We know that depression, and that includes bipolar disorders, but also schizophrenia and other psychoses, are on the rise. Their incidence is high and has been increasing now for about 3 to 4 decades. The initial increase in these incidents appeared to occur about 40 years ago, and oddly enough that seems to coincide with a time when preservatives were introduced in a big way into our Western diets, initially through the fast food industry and later on by the increasing content of preservatives in foods seen on grocery stores. Observational studies which I've conducted over the last 10 to 15 years have shown that patients who suffer from these conditions are more likely to have high contents of preservatives in their diets than those who don't. Some individuals have inadvertently cut back on preservatives in their diet, and what I noticed was that these patients had an improvement in their symptoms. Others, and some of these individuals completely abstained from preservatives, while others just were able to significantly reduce the content of preservatives in their diet. There were a few patients that after discussing with them the issue of preservatives, I got them to eliminate preservatives from their diet. And what they were able to demonstrate or report back was that there was a significant improvement in their symptoms. The key, though, is that this whole process is slow. Some patients will notice some improvement in their first 2 to 3 weeks, maybe even the first 3 to 4 days. But it will take at least 6 to 12 months for patients to see a major improvement in their symptoms. So it's important that patients persevere with this whole process. It's also important that patients do this under medical supervision. The truth is that their GPs, their local doctors, their specialists will not be aware of this link. They may even think that it's all rather phony. But the bottom line is that these patients need to be ensured that they've had a baseline level of a baseline check prior to commencing on such a diet, and then they should have regular checkups, which usually means every 3 to 4 weeks, just to ensure that nothing untoward is developing, because this is all an evolving process. But the data is there. The observational data is there. Patients with mental disorder are far more likely to consume a diet high in preservatives. Those patients who reduce their preservative intake will notice an improvement in their symptoms. We just have to ensure that it's done safely.